Hi, this is Kathryn Lopez from National Review and the National Review Institute. And I'm delighted to have some time here with Jor-El Godsey, the president of Heartbeat International. And you're based in Columbus, but you're in Birmingham
Yes, Birmingham.
because you have a conference coming up this week, right?
We do. It's our 54th annual conference. So we've been at it a while. It's our on tap to be our biggest ever. We're excited for it. And man, so it's breaking news even as we're unpacking our suitcases and getting ready for a big conference here.
Right. And so it is a big deal to be having this conference at any point. But the Ethics and Public Policy Center just came out this morning with a report about chemical abortion pills and how dangerous they are. And one in 10 women have complications. 22% higher complication rate than the FDA has told us.
Yep.
And so, yeah, Jor-El, talk about your reaction to this as someone who heads our biggest network of pregnancy centers.
Well, it's been one of those things where on the ground, working in the centers, we've known of this type of challenging impact by an abortion decision. What we didn't know was the actual evidence of the physical harm. But every day in pregnancy centers across the US, we're encountering women who would tell us they've had these difficulties or they've experienced these in the past. And so now it's very important that this is becoming known to everybody, that there's an actual analysis of this using what was it, more than almost 900,000 women, over the last just 7 years
Yeah.
of data. So to be able to kind of pull that information and make it real really stands up to the face of what we hear women saying, which is essentially they say something to us like, I never knew, like I didn't know, because the abortion industry is telling her this is simple. It's just another, they even call it medication abortion, trying to make it as benign as possible when we know it's an introduction of dangerous chemicals into her body, certainly deadly dangerous to the baby within. And now we're learning it's even more dangerous than what was ever promoted by the FDA for her herself physically.
And I am increasingly convinced that most Americans don't even realize that chemical abortion is a thing. And yet, at least two-thirds of all abortions in America are chemical abortions at this point. And not only, we've got news recently that some major Planned Parenthoods are closing, including the one in my New York flagship Margaret Sanger Clinic, named after their founder, of course, a eugenicist. Um, but I'm delighted that Planned Parenthood is closing. On the other hand, it is a sign of the times. They don't need the clinic. They're not. They actually, for a few months, haven't been doing surgical abortions, supposedly because of a complication with the heating system or something, the HVAC system. But they don't need to do them there because the hospitals do them, and the majority of them increasingly are not surgical abortions; they're chemical abortions, and either people are going to a clinic for them or a hospital, a doctor's office, or they're getting it prescribed by telehealth. I mean, can you imagine? You're already in this miserable situation with an unplanned pregnancy, scared, don't know what to do, and you don't even physically see a person who's prescribing this medicine for you. To have, I always remind people that movie Unplanned about Abby Johnson, former director of a Planned Parenthood. It is rated R because of the scene in her bathroom when she's dealing with the end result, physical result, or you could argue that's not even the end physical result, but she's dealing with the abortion in her bathroom because it's so bloody. And they didn't overdo it. They probably dialed it back, to be honest. That's why the movie's rated R. This is what we're leaving women and frankly girls, college age girls, high school girls, to deal with on their own in so many cases.
Yeah, in fact, I talked to Abby at one point about that and that particular scene, and she said it was intentionally toned down from what she herself personally experienced. And we've heard similar things from other women. So her situation is not unique. It's not uncommon. It was known that mifepristone, in particular, the abortion pill itself, remembering abortion pill is not one pill but two, but that first one is mifepristone. It is known to be create excessive bleeding. It's known to be a factor that many women who take that abortion pill experience. And it's one of the adverse events that we're seeing in this new report that's being published. The 1 in 10 women that's experiencing that as part of it. But I think you're right, Kathryn. One of the scary things, as I recall, back in the days when the Clinton administration was the one hurrying to change the rules and change definitions in order to rush the approval of the abortion pill through the FDA. They were the same crowd that was talking about abortion should be between a woman and her doctor. And now it feels like they're doing everything they can to remove the doctor from the equation, which really leaves that woman in a very difficult situation. I mean, I don't know most women that walk around knowing their Rh negativity, which is a factor that needs to be analyzed. I don't know how many women are walking around understanding where they are physiologically and how they're able to even receive that. And that's why we have healthcare. That's why we have true healthcare that should be watching out for her. But that's what the FDA has not been doing. They've not been watching out for her. They've simply been watching out for the abortion industry. Not only have they been basically underreporting the obvious effects, as this report shows us, to what is, you said it, 22 times what the FDA is told. And why is that? It's because in their research, they basically only accept very healthy women. They refine the cohorts of these research things so that they can measure the impact against the best case scenario. Well, you and I both know that we don't live in the best case scenario. We live in the real world. And the real world is what we're seeing in these statistics that show her harms 1 in 10. I mean, imagine what that would be like. Like, hey, Kathryn, you and I are going to get on an airplane and we're going to fly. But, hey, 1 in 10 of the people on this airplane is going to develop adverse event and have to seek medical treatment or possibly, be at risk of death. Like, that's craziness. But that's what our FDA has been allowing because it's been favoring big abortion and not working on behalf of the health of women. And you talk about the Unplanned movie. I like you, that particular scene of that abortion happening in her bathroom was terrible. And we know that happens in dorm rooms everywhere. We know that happens in places that it ought not happen. She used to have to go somewhere where the abortion would be there. But now she's turning her own bathroom or dorm room into an abortion clinic. And that itself is terrible. And that leads us to the mental health side of these things, for which this report doesn't begin to address, and we're certain that there's a lot more of that. There's one more aspect is really thinking about kind of the long-term impact of this. And one of the categories you did mention, you mentioned surgical, you mentioned the telehealth, but we also have a raging industry of illegal abortion pills being sent into this country. We've ordered it, we've seen it, we've heard reports. They come in little baggies with handwritten numbers on them with no instructions. And this is a whole nother level that our government isn't even concerned about. We don't even seek to know this information. We're not willing to stop it at the border like we should. So there's a whole nother level where we think the numbers of chemical abortions are underreported significantly because of that and because of what we can't know. They say that there's 70 websites now where chemical abortions can be obtained from around the globe. So there's a ton of things we don't know. And who's at risk for this? The women who are being preyed upon in this effort, who are being coerced or feeling coerced or maybe even forced into that abortion.
And it really is shocking, Jor-El, to go back. You mentioned the Clinton administration. Safe, legal, and rare was also the terminology that Bill Clinton very wisely used, knowing that people don't like abortion, even people who identify themselves as pro-choice. It's because they want to know that women in desperate situations have choices, right? Have options, which is where Heartbeat International and your network comes into play. people actually on the front lines walking with women. Um, but it's neither rare or safe is what we're seeing. And there's another aspect to this besides the fact, I keep pointing out to people, I'm going slightly going blind, too many years of reading. And in New York State, I cannot order these glasses. They're cheater glasses, 3.0, whatever that means, magnifying strength. You can't buy them in New York State. I can't get Amazon to deliver them to me
Mm.
because the ophthalmologist lobby has made it so that you can only sell up to 2.7 in New York State. And yet, there are New York doctors sending pills across state lines. We have a lawsuit right now.
Yes, we do.
Um, but speaking of lawsuits, I want to talk about the abortion reversal
Yeah.
procedure, and you're being sued, or some of your affiliates are being sued.
Yep.
Tell me about that.
Well, in late 2023, we were sued by the state of California for the promotion of the abortion pill reversal. As I mentioned before, the abortion pill is not one pill, but two. And there have been many women who have taken that first pill and changed their mind. And said and asked themselves, what can I do? And some we've actually had go right back to that same abortion provider and say, I don't want to go through with this. What can I do? And they lie to her. They tell her there's nothing you can do. Well, in fact, there is. There is abortion pill reversal, which is simply progesterone. It's introducing a high dosage of progesterone to kind of outcompete the mifepristone. The mifepristone is essentially designed as a progesterone blocker. And the
Right.
only way that we know now to kind of combat that, if she's looking for that, is to give her more progesterone. Well, progesterone is what she produces naturally. So it outcompetes, and it does so pretty successfully. 2 out of every 3 women that try to do that in the inside of about 72 hours, we've seen as being successful. And for some reason, the state of California doesn't like that. And now the state of New York, because they're the ones that followed up right after that with something similar from Attorney General Letitia James. So we've now been sued in 2 different states. There have been a number of our affiliates who've been providing abortion pill reversal, who simply are saying, we can help you change your mind about consenting to an abortion you no longer want. Like, who should be against that? No one. It's just progesterone. It's not the exotic lab-produced drug. That's the actual mifepristone, the abortion pill itself. It's simply giving her more of what her body already produces to sustain that baby. And that's exactly what we've been involved in this. And somehow our abortion states, California, New York, and others, Colorado's in on it as well in a different way. Vermont is in on this as well. They somehow can't not allow or stand for women to simply have the choice to change her mind. And that's what she should be able to do. And so we are excited about the lawsuit so that the truth can be told and more women can know that they can change their mind about an abortion they no longer want.
And so often when we talk about abortion in a political context, the image we're given are of all middle upper class women, college educated, perhaps in college. Sometimes you're dealing with a 17-year-old girl who's still in high school and scared. And I'm thinking of one situation in particular that I was involved in, where she took the first pill. She walks out of the clinic. She takes a deep breath. A woman approaches her, a counselor, and asks her, what she's there for. And she starts crying that she just took the first pill. And she had no idea that there was anybody who would walk with her. Everybody was pressuring. The few people she had told were pressuring her. And so when people for good reason might wonder, well, why didn't she make a decision before she went into the clinic? In many cases, because she's scared and she doesn't know what the resources
Yes.
are. And
Yes.
and that's on us pro-lifers to make sure that we know what the resources are, so we're sharing them with people even before a couple winds up in an unplanned pregnancy situation, right? But these are real situations that happen all the time. And when there is a possibility to undo what has started, And it's safe. And like you said, it's not this mass produced pill cocktail, right? um let women have this option, right? As we've been saying, the abortion advocates have always doubled down on that choice language, but so often women and girls don't feel like they have choices.
They don't. They feel forced. Well, some are actually forced, right?
Yes,
Some are pressured by their boyfriend, by their partner, by their
yeah.
parents.
By their
And
pimp. There's that too.
there is that. I mean, it's true. Sex trafficking relies on abortion, for its industry, and it relies on things like the abortion pill for its effective commodification of women. And so these things are all part of the landscape that we confront and are dealing with. But it's very much about putting that woman at a disadvantage. She's been trying to do everything she can to have an advantage, and here she's being placed at a disadvantage. And that's what the big abortion culture does as well. It simply says you can't even succeed without abortion, so you have to have abortion around. Like, to me, that is, that's the lie of our culture today. And so the woman in there, even if she's got good things going for her, she can't often see those things in the moment. How many of us have been in situations where we do something and we immediately regret it? Like, we've all done stupid things from time to time, and things that we didn't really want to do, and then we did them, and suddenly we're faced with the consequences. And that happens in abortion more than people want to admit.
Right.
And that's the kind of people that we deal with every day. Our Abortion Pill Rescue Network answers the phone 24/7, trying to help women who are suddenly have just taken that pill and are now trying to chart a different course. And so we're there to help them because of the very fact that they need a chance to change. They should have a chance to change their mind. And that also, even before the decision's made. You mentioned, Kathryn, something very important, that we have help, the very, very best help I should say, the very best alternative to abortion is another person, right? Someone who can walk with you, stand with you, who doesn't profit from your decision. That's key. Who's able to bring resources to that moment, resources of, first of all, belief, just believing in that person, caring for them, and then helping them with things like, do you need an ultrasound? Can we get you care? Can we connect you with what's going on, with the things that are available to you for your pregnancy? Those things exist in every community. We're so excited to talk about the fact that there are nearly 3,000 pregnancy centers in the U.S. We finally went over 2,900 pregnancy centers around the U.S. in every single state, and more than 55% of the counties. And it's so this help is available all the time, everywhere. And we love to be a part of it. We love to be connected with it. We wish we didn't have to. We wish that the women knew their support, that knew that they could do these things themselves. But we're happy to stand with them and stand for them as they seek to change their mind about the direction that they feel pushed and coerced into.
I think I've heard you say you'd be happy to be out of business, right?
Absolutely.
Yeah.
Absolutely.
Um, Now, so we have an administration that has told us it's pro-life, and the ball is in their court now. I think with this report, I the low hanging fruit would be for the FDA to maybe halt the sale. And obviously this medication, so-called medication, needs regulations that are not in place. And so a whole overhaul of how these pills are being dispensed is completely necessary. And it's the kind of thing that in a sane country, people who describe themselves as pro-life and people describe themselves as pro-choice could get together on, because as you mentioned, informed consent is not a thing in most of this country. And so if we could at least work together to get to that point, right? You and I want to end abortion in America. The, for the sake of women, yes, the unborn children, but women too, and men, frankly, for the sake of families, and our culture. But at the very least, can we start and get together and find some common ground on the safety of women and actual informed consent?
Absolutely. Informed consent, one, that she should know that she has a chance to change her mind, and then let her change her mind if that's what she wants. That's what the actions of California and New York and Colorado and Vermont are all seem to be against, is withdrawing her ability to change her mind. That she should have, even as they would say it, in their rush to create a right to abortion, they should honor their own words, which is a right to continue her pregnancy. And so women should first and foremost have the right to continue the pregnancy. That is part of the natural order, right? It's part of the biology that we as humans share. This reproductive value which we should have, which a segment of our culture is trying to diminish and even destroy. But we should first honor her, even as we honor the life within her, right? Those are both things that we should carry. We should love them both, care for them both, and walk with her to help her find the best path forward that with a decision that everyone can live with.
And as you point out, that love them both is at the heart of the message here. And So you're having your annual conference. What are you most looking forward to at the conference? Obviously, there'll be buzz about this report and an eagerness to see some reaction from the federal government. And I know you have Ryan Anderson, the president of Ethics and Public Policy, which put this study together, speaking at your conference on Friday, I think.
Yes, that's correct. We didn't know that he would be at the epicenter of this when we talked to him several months ago about being part of our lineup, but we're grateful that he's here with us and will be part of our event. We are excited to be gathered together. Like that's our first and foremost value is bringing people together. Since Dobbs, a good segment of our folks have felt challenged, beat down, belittled, diminished by the aggressive abortion policies of some of our abortion states and the continued kind of challenge to where even in our so-called life states, you know this, Kathryn, that abortion pills are flowing into those states. There is no state where the abortions are not happening.
Right.
They've been reduced in number thanks to some of the laws, but this chemical abortion thing is throughout our land. And so that'll be one of the major topics that we'll be discussing during our week together. Is about how do we do that? What do we do with this information from this report? How do we let our own folks know about this? Because this is information that should be in every pastor's hand, every priest's hand. It should be in every parent's hands. The fact that chemical abortion causes real harm, and we need to make sure that everyone understands that better.
Yes, and we really don't want to be a country. And again, I think people who describe themselves as pro-choice could agree with this. We don't want to be a country that's quietly giving pills to college students and young women and hiding what's actually happening, both the abortion, but the dangers to women, in addition to the mental and other health dangers that abortion is. And pregnancy centers, the people you represent, the people you are, because that's where you come from, that background. Um, you're not sinister. There's been political attacks on pregnancy centers as if you're trying to be obstacles to women's freedom. You're seeking to do the exact opposite, as we've been talking about. And when people, if people, because it doesn't get a lot of coverage, but if people hear about these abortion reversal protocols, the abortion pill reversal protocols, it is simply following the science, as you were pointing out. This is a hormone therapy, essentially, right? And it gives women more options when they feel like they have none. And I know you're super busy, Jor-El, always, but this week in particular, thank you for the time. And where can people go? First of all, you have a hotline
We
um,
do.
for women who are pregnant and don't know where to go. And you have a website and all the rest. Where do people go?
Yeah, I thank you for that, Kathryn. I want to make sure everybody knows about optionline.org, 1-800-712-HELP. If anyone has a question or is in a challenging pregnancy situation that they want to get connected with the those that are closest to them, we're able to help. That's also a good line for people to reach out if they know of someone that's in the midst of a chemical abortion looking to reverse, because we have a whole nother set of nurses on our Abortion Pill Rescue Network hotline who are able to talk to them and kind of walk them as quickly as possible to the progesterone that we refer to as abortion pill reversal. So we're happy to talk to anybody. Optionline.org, abortionpillreversal.com, 1-800-712-HELP gets you to either.
Thank you so much for the work you do and for your time. And we're grateful to Ethics and Public Policy for doing this work with publicly available insurance information is what they did. They're doing the work that our government hasn't done for us.
That's
So
right. Thank you, Kathryn.
thanks, Jor-El.